Good evening, class. My name is Ray, and I am here to give you a brief overview on the hepatitis B virus. The word hepatitis itself means inflammation of the liver. When the liver is inflamed or damaged, its function can be affected. Heavy alcohol use, toxins, some medications, and certain medical conditions can all cause hepatitis. However, hepatitis is often caused by a virus. In the United States, the most common hepatitis viruses are hepatitis A, B, and C. Today's short lecture will focus on inflammation of one's liver due to the hepatitis B virus. We have a lot of ground to cover, so let's jump right in. Hepatitis B virus is a double-stranded DNA virus belonging to the family of the Hepadnaviridae. It is considered one of the most common sources of hepatitis infection in some parts of the world, such as Southeast Asia, China, and Sub-Saharan Africa, where as many as 1 in 10 people have chronic hepatitis B infection. Although there are viruses similar to hepatitis B found in other animals such as squirrels and ducks, the hepatitis B virus is found in humans. People with chronic hepatitis B infection are considered infectious and are the primary reservoirs of infection. The main source of hepatitis B virus is located in the blood, but it can also be found in amniotic fluid, vaginal secretions, and semen. Routes of transmission include sexual contact, contaminated blood, either through a litany of sources to include blood transfusions, hospital work, sharing of contaminated needles, razors, toothbrushes, and can even be spread during childbirth. Unfortunately, the virus can possibly pass through the placental barrier from mother to child during pregnancy. In addition, it is more common for the virus to transfer from mother to child during birth, as blood and secretions from the mother are easily placed in contact with the child. Hepatitis B virus is enveloped and surrounded by a membrane. It has a spherical, double-shelled structure about 42 nanometers in diameter, consisting of a lipid envelope containing the surface protein hepatitis B surface antigen. This envelope surrounds an inner protein shell called a nucleocapsid, composed of hepatitis B envelope antigen and hepatitis B core antigen, complexed with virally encoded DNA polymerase in the viral DNA genome. The DNA strand itself is partially double-stranded, meaning there is long and short strand. So the liver is composed of functional units made up of hepatocytes. Hepatocytes' roles include detoxifying harmful substances in the blood, maintaining normal blood glucose levels, and converting cholesterol into bile salts, which, along with water and bilirubin, make up the bile. These, these liver cells are the targets of hepatitis B virions. The hepatitis B virus life cycle begins with binding of the hepatitis B virion to hepatocytes through interactions between cell surface receptors and viral envelope proteins, including the hepatitis B surface antigen. Binding of the hepatitis B virus is followed by entrance of the virion into the hepatocyte through endocytosis. The nucleocapsid is subsequently released into the cytoplasm, where it is uncoated at the nuclear membrane and the viral DNA is released into the nucleus. Within the hepatocyte nucleus, the relaxed circular DNA is converted into a covalently closed circular double-stranded DNA molecule. Once inside the nucleus, the viral DNA serves as a template for ongoing transcription of viral RNA. These mRNAs will leave the nucleus and use host ribosomes to create viral proteins like DNA polymerase and viral antigens HBs, HB core, and HB envelope. HB surface antigens and HB core antigens are assembled into new viral particles. Viral DNA is replicated and packaged into the capsid at the same time, which is why the replication is interrupted and the virus is partially double-stranded. The capsid is then enveloped and released without damaging the cell, which is why the infection can persist for a long time without causing. Interestingly enough, the liver damage isn't caused by the virus, but by the body's immune system. T cells find and eliminate infected hepatocytes, causing liver damage. The B cells react to the virus found in the bloodstream and secrete antibodies against the hepatitis B antigens. Bilirubin and bile salts from destroyed cells go into the bloodstream and diffuse into surrounding tissues, causing jaundice, yellowing of the eyes and skin, which can also cause an itchy sensation. The bilirubin is then filtered by the kidneys and ends up in the urine instead of your feces, resulting in dark urine. So after a person is first infected with hepatitis B, they are said to have acute hepatitis. The incubation period of the virus is anywhere from 1 to 6 months, and most people affected will recover without ever knowing they were infected. Those with acute symptomatic hepatitis B may initially enter the pre-icteric phase, where they present with fatigue, body aches, loss of appetite, joint pain, and nausea that lasts anywhere from a few days to a week. This is usually followed by an icteric phase consisting of jaundice and dark urine lasting from 1 to 2 weeks. Afterwards, patients enter a recovery phase where no symptoms are present. In very rare cases, they enter a fulminant hepatitis phase, which can result in liver failure. This is characterized by sudden fever, abdominal pain, vomiting, confusion, and even a coma. Acute hepatitis B becomes chronic in about 5 to 10% of cases. This is usually after 6 months of infection. Symptoms are similar to acute hepatitis B, but are definitely milder. Everyone with chronic hepatitis B is at increased risk of developing complications, including liver scarring, called cirrhosis, when the scarring is severe, and liver cancer. Insufficient T cell response or an increase in HBs antigen in circulating blood can result in chronic hepatitis B. This is just a brief summary of the signs and symptoms you would expect to see in a patient with hepatitis. The diagnosis of a hepatitis B infection is based on antigen and antibody findings in the blood. A measurement of your serum alanine and aspartate aminotransferase, also known as ALT and AST, can be used in conjunction with a liver biopsy to confirm the presence of chronic hepatitis as well as the extent of damage in your liver. One sample of blood is all that's needed for a hepatitis B blood test, and the panel itself includes 3 parts. All 3 parts are needed to fully understand whether a person is infected or not. Using this table as a go-by, a positive or reactive hepatitis B surface antigen test result means that the person is currently infected with hepatitis B. This test can detect the actual presence of the hepatitis B virus in your blood. And so a positive hepatitis B surface antigen test result means that you are infected and you can spread the hepatitis B virus through your blood. A positive or reactive hepatitis B surface antibody test indicates that a person is protected against the virus. This protection can be the result of receiving the hepatitis B vaccine or successfully recovering from a past hepatitis B infection. A positive hepatitis B surface antibody test result means you are immune and protected against the hepatitis B virus and cannot be infected. You are not infected and cannot spread hepatitis B to others. A positive or reactive hepatitis B core antibody test indicates a past or current hepatitis B infection. The core antibody does not provide any protection against the hepatitis B virus, unlike the surface antibody described above. This test can only be fully understood by knowing the results of the first 2 tests. Now for treatment. And again, because it's an acute infection, most will require no therapy, as most will clear the infection before even realizing that they are infected. For those who require treatment due to progression to fulminant hepatitis or chronic hepatitis, antiviral medication and immune system modulators, such as interferon alpha, are accepted methods of treatment. Plans of care, however, are all dependent on clinical variables, risk factors to disease progression, and the patient's response to infection. Prevention itself is often more important than treatment. Screening of donated blood is done to help prevent viral spread. You should also avoid lifestyle choices that put you at risk, like unprotected sex and intravenous drug use. For hospital workers, intravenous drug users, people with multiple sex partners, and birthing mothers and their children, and pretty much everyone else can get vaccinated. Proper vaccination can provide anywhere from 98 to 100% protection from the virus. Also, if an individual is exposed to the virus, hepatitis B immunoglobulin can be provided within a week after exposure to prevent the disease. Here are just a few fun facts about hepatitis B. Having a cesarean section does not necessarily prevent the virus from spreading. Also, experts believe that breastfeeding is safe for hepatitis B positive mothers. And just as a heads up, hepatitis B virus can survive on surfaces outside of the body for up to 7 days, so make sure that you guys are wiping down your surfaces after use. And here are just a couple of review questions for you all. and here's a copy of all my references. At this point, I'd like to thank you all for your time and your patience, and I look forward to all of your questions.